All right, everyone. Welcome back to Chiro Shift, the podcast that will change your perspective of the chiropractic profession. I'm your host, Dr. David Newton, and today we are joined by one of the smartest physical therapists and strength coaches I know, Dr. Katie Dabrowski. Katie is a professional's professional. She's an advisory board member for the Society of Sports Neuroscience, adjunct faculty member at Nova Southeastern University, and someone who provides mentorship to students, physical therapists, personal trainers, and strength coaches through educational seminars and shadowing programs to promote her overall mission to change healthcare. Something we can absolutely agree on. So, Katie, welcome to the show.
No pressure with that intro. Thank you so much. It's an honor to be here. I love this whole team and what you guys are doing. So really happy to chat with you.
You know, I just wrote down the things that are on your resume. So these are all the things that you are. We didn't buff any of this up. This is just who you are. And as I already mentioned, like we're so excited to have you here, and I hope our listeners get a lot out of this episode. So I do want to start with your mission, and I think it's a mission that we very much share here on our end, which is to change healthcare. Talk about why that's so important to you and why we need to see change in both of our professions and across healthcare, respectively.
Yeah, I think first and foremost, I want to say as well, and I think we're aligned with this. When it comes to like musculoskeletal rehab, I really do consider chiropractors and physical therapists to be on even playing fields when they're really good and when they're really bad. So I feel like excellent chiropractors and excellent physical therapists are one and the same, and really horrific physical therapists and really horrific chiropractors are also one and the same. And I think like whenever I talk about rehab, I hope the message is coming across that I'm always roping those two professions in together. I love collaborating with other rehab providers because I think, as you said, at the end of the day, if our mission is to change healthcare, we're on to something. For us at Old Bull, our mission of changing healthcare is really, it's kind of double-sided. On one half, it's all about changing healthcare for the patient, which I think is what drives most of us. We always say we want to give somebody an experience they didn't even know was possible. And that goes for so many things, not only just like the intervention that we're employing, but also just the atmosphere and the fun that they can have in our setting. And then on that other end of the spectrum, I think that a side of it that often gets overlooked is I want to change healthcare and we want to change healthcare for the provider. I think there's a huge disconnect in actually like the setting being something that a provider wants to be in. And I think that's a really big problem for our professions and for burnout. So our mission to change healthcare, it covers both bases. Of course, the patient is our utmost concern, but my team and the providers that work with us, like I want to change healthcare for them too.
Yeah, and I think we do see that a lot in both of our professions, right? There is a lot of burnout, and I think a lot of that has to do with the constraints that exist at times within healthcare and how that can really push us in directions that maybe we don't always want to go in. And I think one thing that both of us try and do on a regular basis is really, look at what the current body of evidence says and really try and update our viewpoints to continue to better ourselves as healthcare professionals. And I think that has both pushed us down this road of encouraging patients to be a little bit more active in their own health, right? I think a lot of times when people think about chiropractic or they think about physical therapy, the things that come to mind are very much modalities or treatments that are happening to them, right? It's maybe with PT, maybe it's a little more exercise based at times. But
I honestly think that exact same perception is what exists for therapy as well. Like I think I think we're kind of in bubbles and we think it's moving along better than it is. But I really think the general public still thinks that if you're going to a chiro, if you're going to a PT, you're just going to be on a table. Like that's it.
Yeah, and I mean that's part of our job, right? Is to get people to understand and to educate them what the importance is of them becoming involved in their healthcare plan. And I know one of the statistics that you talk about very often is that we're right around 20%, maybe right above, maybe right below, as far as Americans who are meeting physical activity guidelines, and how that in general is something that's so important to people's health. I think when we begin to have these discussions around like what does it mean to be in healthcare, what does it mean to be a physical therapist or a chiropractor, as you just mentioned, we get stuck in these bubbles of what that looks like. But ultimately, we're in it to not to make, but to provide support for people to live healthier lives. So from your perspective and what you try and do with your job and your career and where you're at, how do you tend to integrate these ideas that people should be more active, and how do you begin to have that conversation with patients or clients that maybe aren't expecting to have that conversation when they come to meet you?
I think first and foremost, when people walk in the space and see like a kettlebell that weighs 200 pounds and huge squat racks, they're kind of getting the message. um, and I think like we designed it that way on purpose. It looks like a college strength gym. And something that we're really proud of is that we often have people who come in thinking they don't belong in a setting like that. And after the first session, realizing that they do. And I think we're just trying really hard to create the understanding that every single person deserves to be physically active. Every single person deserves care that looks like what a professional athlete would get. And I think opening the door for that for everybody in every age range, every background, every experience is huge. And I think that really does come with just like what our setting looks like. So it's starting there from the get go. And also on purpose, like we have a lot of fun and we're silly and we joke and we make sure everybody is having a good time. Because again, if you are new to exercise and you walk in a space like ours and you see a bunch of meatheads not talking to you and not making eye contact with you, like you're going to feel like you don't belong. And there, boom, is another barrier to entry for exercise, which is already a huge issue. As you mentioned, if around 20% of people are meeting PA guidelines, we don't really need to be setting up more barriers for people to start moving. So I think it's a lot about just the setting and also like as a provider, having fun and not taking yourself too seriously. I think that's huge. And then beyond that, like just the ability to have the conversation of how important it is to, stay active throughout the lifespan, and that more often than not, people who are getting older and think that's the reason that they can't, it's simply because our, societally, we just stop doing stuff. And it's less about it being a thing that you can't do anymore. It's just a thing that you've stopped doing. And now starting up again is a little bit harder. So I think normalizing the human experience of, yeah, it's hard to exercise. Yeah, it's not comfortable. And relating to people on that level and just making it like a more comfortable onboarding to exercise is part of our mission for sure.
And I want to bring it back to a couple points that you just mentioned there, because there were a few really good tidbits in there. And the first one that I want to go to was the environment that you create at Old Bull, and the feeling that people have when they immediately walk in the door as this very welcoming and less threatening environment, which I immediately agree with you in the sense that them stepping into a place that feels welcoming, that feels fun, already puts them in a better frame of mindset to begin this process of working towards whatever goals they have, right? And this is so incredibly important. And even if it's not what some people expect as far as coming in and seeing 200-pound kettlebells and barbells and things that potentially could be intimidating to some people, I think this idea that allowing people to be more comfortable in something like a strength training realm, where more traditionally it could be a little bit scary, allows them to work towards some of the things that we know can have a great effect as people age, so that they don't feel like they're limited as they continue to get a little bit older. And I know one quote that you have, I posted, I think a month or two ago, was that muscle mass is a cheat code for life. Can you explain to people a little bit, why it's so important for us to continue to strength train and develop some level of muscle mass on our bodies as we age? Because I think, again, PT chiropractic, we're not always thinking about strength training and muscle gains. Why is that something that could be beneficial for pretty much anybody?
Yeah, I say this probably ad nauseum like every day, and my clients are like, "Oh my God, we get it." But it's so true. I could list a million reasons why this is the case. I think some heavy hitters for me are independence for life. Like stuff just gets really hard if you're weaker and unable to achieve tasks. And I don't know, I wanna be the badass 70-year-old throwing my suitcase in the overhead compartment when I'm on a plane, and I wanna be able to go on a trip and hike, and I really don't think the general public understands that those limitations with age are almost purely because we're getting weaker, and but the good thing about that is it's so actionable. Like, I think there's this really big misunderstanding that, it's just this inevitable decline, and there's nothing to do. And that couldn't be farther from the truth. We're getting more and more evidence that it's absolutely not only possible, but it's happening all of the time. The ability to continue to build muscle mass throughout the lifespan. Is it as easy when you were 20 years old? Maybe not. Is it impossible? Absolutely not. And the conversation I always have with somebody, it just gets easier the earlier you start. The ability to maintain your minimum effective dose of training is so much lower throughout the lifespan, meaning you have to do less to keep staying fit if you've done a lot in the beginning. So, and that's not to discourage people from starting later. It's literally, there's like a Chinese proverb, what's the best time to start? Today. Like if you haven't done it 10 years ago, it's going to be today. So I think if we can empower people and help people understand, like, this is so actionable and there's things that we can do to get better and to have you just really look at the next phase of your life as something that's exciting instead of daunting. I think that's huge. And really empowering. Like I know for myself too, as I'm in my 30s, and I think that actually kind of is better getting older in this profession and being able to talk with people and be like, hey, it's possible to feel better in your next decade. Like you don't have to think that it ends here. I'm fitter and stronger and healthier in my 30s than I was as a college athlete when you would think it's supposed to be your peak. And there's so many opportunities for people to keep getting better. So I think that's like the thing that stands out to me the most of why I always say that saying. But then also if we just think of physiology, like the more muscle is a living organ and it's a protective organ, and we can think of it in a way that protects our bodies against stress. So there's relationships between muscle mass and testosterone and cortisol, and we can better buffer our stress response if you have more muscle. Testosterone and muscle are protective against stress. And so I say it in a joking way, but like just get jacked and like everything gets easier. And but it's true. Like we know that we mitigate the bad effects of cortisol with more muscle and more testosterone. There's evidence of people who train really hard and they have high amounts of cortisol because of training stress, but they can manage it because they have this beautiful protective layer of muscles and all of the great things chemically that happen with that. I think if we understand like the physiological side of it, that's also very important. You don't have to give somebody an anatomy lesson, but having a conversation like that, I think it goes a long way. So those are like the two big heavy hitters for me of why I always say that it's the cheat code, because it just is.
Absolutely. And I don't know the populations that you tend to work with on a regular basis, but I've worked with some people that are older than I thought I would ever feel comfortable working with. And I think a lot of that comfort came from the confidence that everyone can strength train and that we don't necessarily have to make it look different for someone who's a little bit older compared to someone that's an athlete. I have someone that I'm working with currently who I think he just turned 82 years old. He's still out there deadlifting, 330, 350 on any given week, and he feels great. And I think a lot of people would look at an example like that and just be in complete shock and awe. And even sometimes I am, to be honest, because I'm like, look at
Yeah.
this guy. It's amazing what he's doing. But, my vision for healthcare is very much that this isn't necessarily this one-off thing. It's not this rare occurrence that you see people that are in their 60s, 70s, 80s, potentially even 90s out there running or lifting weights or doing things of that nature. Because as you mentioned, there is no age where you cannot do these things anymore. There are almost no barriers for us to try and get people into these settings where they can begin to develop some of that muscle mass so that, as you just mentioned, their day-to-day activities become so much easier for them to really begin to affect quality of life, which unfortunately we see decline so often because people are not engaged in activity at the levels as they used to be. So I think something that tends to happen, unfortunately, for a lot of the clients or patients that we work with is that at some point in time, they see a provider or they see someone who says, you know what, you're at that age where you shouldn't do this anymore. You shouldn't pick up a barbell. You shouldn't back squat. It's bad for you. And I think those words tend to really stick with people. And to me, it's always a challenging conversation when we meet someone like that, because I think sometimes these narratives are just so ingrained in the way that they think about day-to-day life that it becomes an uphill battle for us to convince them otherwise. When you run into these situations and you're working with clients or patients who have been told these narratives before and are afraid to begin down that path, how do you tend to get them started so that you can slowly build that confidence in them and they can return to doing some of these things that are most likely going to be beneficial for them moving forward?
Yeah, you made so many great points, and that's a great question. I think it's something that a lot of people struggle with. We all still do. Like, it's never perfect. Um, there's a few things. I was talking earlier about this with somebody, and I think something that's helped me a lot is just having a lot of empathy for that person who, um, probably for 40 years has been told that X movement is bad for them, or running is going to cause arthritis, or jumping is bad for you. And we're not going to change somebody's mind in one visit. It's just not going to be possible. We can get the wheels turning, but I think we have to understand that we're not going to completely shift their entire worldview in one visit. And I think that's really important. And I think that's something that as I've gotten more experience, it's helped me drive like the conversations of these really important topics that I think maybe before I used to turn into a lecture because I know it's important and you have to get this information instead of now, like, I'm not going to force feed you stuff that you're not ready for. And I think that's huge. I think that is a starting point. I've also talked about this before. Like, I think we also take for granted how lucky we are to be in a profession that we understand the nuances and intricacies of physiology and psychology. We understand that exercise is really, really good and it's not dangerous. We can filter out the bullshit really, really well because it's our job. We also understand how complex and emotional pain is. The average person does not understand those things. And I think that's another really important thing to consider. Like, we don't get up every morning and if our knee hurts, immediately think that we have a meniscus tear that requires surgery. We're like, oh, my knee feels funky. It'll probably feel better today. Or, oh, I'll probably just load it a little bit and see how it feels. Like, the average person doesn't have that luxury. They're scared with every time they feel a pain. They think they are literally deteriorating. And I think that's really important for us to remember. So I think starting with that realization is huge. And it's been something that I've gotten better at over the years. And then understanding that somebody's entry point may be even less than what I think it should be. And that's also okay. I think that we want to push people, and we know, like, okay, I need to make an adaptation, I need to make a change. For somebody who's starting at zero, very little is going to be adaptive. So that's also okay for us to have a starting point that's a little bit lower than what we think. Um, and then kind of the third point with that, you mentioned like we're fans of Craig Liebenson. He's an incredible mentor of mine, and we've worked a lot together. Um, Something he always says is give people a positive experience with movement. So even if I do nothing else, if I just have fun with somebody and I make them relax a little bit and I joke around and I make it fun and I'm not staring at them, criticizing their form, making them feel like if they do something wrong, their spine's going to explode, I think that goes a long way. So just having fun with people and getting them to enjoy the process of moving when maybe they never have before, I think that's a pretty big step in the right direction.
And I couldn't agree more with all of that. And you talking through that reminded me of a quote from, I believe, Peter O'Sullivan. And I know this influenced the way that Craig has about things recently, and it's definitely changed the way that I've thought about things recently. But the quote was something to the effect of, we don't have to change people's beliefs to begin to change the way like that they act or that they go about things, right? So I was the same way as you, where I was so passionate about these things. I look at myself probably, 3, 5 years ago that it was, yeah, you have to change. You have to do these things. I don't care if you're not ready. It's so important for your health. We need to take action now instead of being empathetic, instead of meeting that patient where they're at on that given day and just giving them a good experience. I think that's so incredibly important that people have a positive experience when they're in healthcare settings. And it's not something that happens nearly enough. So for you guys at your facility, and to be so aware of this idea that you want to make it fun and you want people to look forward to showing up there and you want them to begin to enjoy some of these things, sometimes we don't even have to have this conversation that these things are important for you because people just begin to enjoy them and then they ask for more. And I think that's such a cool thing as a healthcare provider, to not have to explain something to someone, but just to see them experience the positive changes that we're looking for through the actions that they're ready for on any given day or any given moment, which it's an incredible thing to see. I know we both deal with, people that probably tend to have active goals, and they come in with all sorts of diagnoses. Most of them are within the musculoskeletal space. That's where we tend to operate. And something that I know we both agree on, and this is something that you've talked about again through your social media posts, is that you don't always care about diagnosis in the realm that we're working in, right? So I want to be very clear with that. This is not all health diagnoses. Some
Right.
diagnoses are very important, right? But in the realm that we're working in, with musculoskeletal health, diagnosis is not always that important. Can you explain to people why that is, and then why we have the freedom to take different approaches despite the diagnosis maybe not holding as much as importance as it would maybe in other settings?
Yeah, absolutely. And I always give a similar disclaimer of like, I am not just throwing away all diagnoses. And I'm also, even in our space, not throwing away when they're important. Um, one of the things I often tell people, and this is, clinicians that I'm working with, people on the team, as well as clients that I'm treating, is, unless there's been a very specific trauma, a very specific mechanism of injury, and very clear, severe red flags, most pain is because we pushed our bodies to do something it wasn't quite ready for. And again, there are scenarios when that isn't always the case, but you can argue that that is the case for a lot of people, especially with like common orthopedic aches and pains. I'm not talking about post surgery. I'm not talking about something where there was a very clear mechanism or an accident or a trauma. But usually it's because we've exceeded the current capacities of our tissues and we just weren't quite ready for something. I love that explanation for so many reasons because it shows the very clear instances when it would warrant a diagnosis versus the many instances when it would not. And then also shows that this is actionable. If you weren't prepared, we can make you prepared. That's literally our job. And that goes for trainers, coaches, athletic trainers, chiropractors, PTs. All of our jobs are one and the same: movement and making people prepared for the things that they need to do. That levels the playing field a lot for healthcare providers. Like, it gives us all a seat at the table. I think that's really important too. And so if we can show people that this is about preparedness, this is about you making your body so resilient that it can tolerate what it needs to. It's not bulletproofing you because I can't prevent something from happening, but it's making your body so able to tolerate stress that even if something does happen, you're going to handle it better mentally too. And I think that's very important. I think there's a lot of just this like black and white thought of what pain and injury is. Pain is either structural damage or you're fine. Like, pain is either you have pain and you're unhealthy or you're pain free and you're healthy. And I don't think it's that black and white. Pain isn't the best indicator of tissue damage and it isn't the best indicator of health. Plenty of extremely healthy people have pain still. We all lift and work hard and train. We all still have pain too. Just because we're in this profession doesn't mean that we're immune to it. It's a human experience. So I think that's another part of it too, is like humanizing that pain is okay. Pain is human. We're all going to encounter it. And we can just be better able to, built to tolerate it and to handle it a little bit better. I think that's a lot of it. The whole side of the diagnosis, it's tough because I know it's what people are craving a lot. But I like to frame it more of, I will at the end of a session debrief what all of my findings are and also spin it in a way that's more about hi buddy, spin it in a way that's more about, look at these actionable things that we can work on. We found that this movement was really tough for you. Okay, now we know exactly where to start because we have an anchor point to work toward. I think that's empowering as well, instead of throwing a diagnosis on somebody where now they feel medicalized even more and like something is wrong with them when like their knee just needs to be a better knee and bend a little more. Like, that's a huge difference from slapping a label on somebody.
And I think the way that a lot of people think about things, and this is probably the way that I used to think about things as well, is very much that you have to have the diagnosis because the treatment is dependent on the diagnosis. And I think some of the points that you just made were really powerful in the sense that, when we go through our evaluations and we talk to our patients and we begin to understand what their goals are and we begin to see what their limitations are, and we start to get this picture that, as you just mentioned, that they're doing too much too soon, they're not prepared for these things, the beauty in that is it does very much give us options to progress for people. And I think this idea of needing a diagnosis so that we can treat, the underlying ideas behind that are very much that we just want to have confidence in the direction that we're going. So to me, like diagnosis to treatment, it's just, okay, we're confident in the plan that we're going to develop now, right? So if we can
Mhm.
remove diagnosis, because in our setting, it's not necessarily important for some of the things that we work with, but still provide that level of confidence for our patients or clients, I think they can still walk away, and they do walk away feeling really good about the plan because, again, we've shown them things that they can do. They walk out the door a lot of times realizing that, oh, I can pick up that barbell off the floor, or I can do a squat and my knee's not going to explode. And that builds the confidence. So now we're not really focused
Mm.
so much on this idea of what's the diagnosis and appropriate treatment, but again, as you alluded to at the end there, where we're very much highlighting the things that are going to be beneficial for them, and they know it because they've experienced it within that session. And I think this leads into another point that I think is so incredibly important for people to begin to understand, is that pain doesn't always need to be our primary emphasis of care, despite that probably being the reason why a lot of people show up. So I want to go into that just a little bit further, because I know you kind of mentioned that a little bit in there, that pain can be present, but we can do other things. Why is it so important for us at times to show people and to allow people to begin this journey with the goal not always 100% focused on just pain reduction and getting to this baseline zero? Because you mentioned healthy people have pain all the time. So how do we go about that conversation?
I love the segue into this, and I want to speak to what you were mentioning about confidence because I think that's been a huge topic of conversation with people that I'm working through with mentorship or people on my team. Because I really think part of what's missing sometimes is when people are getting tripped up over trying to provide non-diagnosis driven care is the thought of like, okay, well, is this person going to trust me if I'm just like, yeah, diagnosis doesn't matter? I think part of our job is to convey confidence in why it doesn't matter. And I tell people when I'm working with my clients, I'm always telling them my number one goal is your safety. And that's for a few reasons. I want to keep you safe. And then also, literally, my job is on the line if I don't. And my job is to keep you safe and to do no harm. So every single time you come in, I am making sure without a doubt that there is no reason for me to suggest further diagnostics, imaging, or any other specialist who needs to consult with you, because that's the most important thing. If I identify at any point that that's necessary, that's what I'm going to do. I'm going to refer you where I need to. If I'm not doing that, it means I've ruled out and accurately assessed that we don't need that and we're safe to continue. And I explain that to people day one, and I explain it to them as many times as they need because people want to feel safe when they're in pain. We're dealing with people in arguably the most vulnerable points of their lives, and they're coming to us with pain. And that's a huge responsibility that we have to take seriously. So I go out of my way to make sure I'm very transparent in what my decision making is and why I know that we are safe to exercise and safe to do what we're doing. I think that's a huge part of it. And I think that already starts to kind of like tear the wall down of somebody who might feel that they need a diagnosis. And that's been really helpful in my career. So I think that's a huge part of it. And then if you could remind me of the part that you just asked, because I just got on a tangent, your segue question. But I wanted to touch on confidence because I do think that's important.
No, I agree completely. To bring back the other question, the question was really talking about pain and
Mm,
not always making that the primary emphasis of our approach to treatment, despite the fact that that's the reason why a lot of people will come in. Why is it so important that we at times shift the focus and the emphasis away from the pain to some of the things that might be a little bit more under our control given the circumstances?
yeah. Okay. Thank you for the reminder. So, yeah, this has been a big shift in my own practice over the years because I think you can attest to this as well. In school, we're taught that like pain, pain, pain. We get people out of pain. Pain is what we're assessing every single time somebody comes in the door. 0 to 10, what's your pain today? And when we make it at the forefront of the conversation, it starts to feel like it's the most important thing in the room. And I think if part of our job is to also show people that progress looks different than only measuring pain. As I mentioned, we have elite athletes who are in pain and they're performing phenomenally. That in itself is evidence that pain isn't the whole story. And we have people who also are, chronically in pain, yet their injury happened 20 years ago. There's tissues have healed and they're still having pain. So that also gives us a lot of information that this is a little bit of a different conversation than it just being structure or just being pain related. And we want to tread this carefully because you don't want to make people feel like you don't care about their pain or that it's not important because it actually, of course, is. But we want to start having those conversations early of, I like to tell people, the metrics I use for guiding progress go beyond just your pain experience. It's a part of the equation, but it's not everything. And that's because we know so much now about pain that it doesn't tell us the whole story. So, some other things I'm going to look for in our journey together are going to be some milestones that we want to achieve based on what your goal is, as well as things like, okay, how much function are you able to get back that's different compared to when you came in? What can you do this week that you couldn't do last week? Or if you do have a flare up, does it last 2 days instead of 6? Or if you do have pain, is it a 5 instead of an 8? And I think having that conversation is important because I really don't think people know that about pain. Most people who come to us truly think that because they have pain, there's something terribly wrong. And the only way they are deemed healthy again is if that pain is at 0 and they never experience it again. And that's just an unrealistic expectation. That's something that I think by telling people we're bulletproofing them and we're fixing their pain, it's just not setting people up for success because now they have this idea looming over their head that I'll never be normal again unless I'm at a 0 out of 10. And pain is part of the human experience. I think we have to humanize it more. And even I'll be vulnerable with my patients too and tell them about my pain because I want them to know that yeah, I train really hard. I'm worked in this field for a long time, but it doesn't mean it's perfect. I still get injured. I still have pain experiences. There's still things that I do where I might get a little bit of a flare up. And being vulnerable about that, I think, is important. And it gets away from this idea of I'm not healthy unless I'm pain free.
And I want to reiterate your point in that we're not and we're never saying that the pain doesn't matter. Of course it does. And of course, that's the reason why so many of you go and seek help or continue to seek help because you have not found someone who's been able to address these issues for you. I think the points that we're very much trying to make here are that it can be really important to start to track other things so that we can measure progress from various angles. And I think examples that come to mind for me are very much that we could have someone that maybe we're into week 2, week 3, and if we were to only look at pain metrics, there wouldn't be a substantial amount of change. But maybe they're back to being able to work full time and they're back to being in the gym and managing workouts, or they're back to being able to play with their kids. And this is tolerable now, despite some pain being there. So if we were to only look at pain and pain levels were on average the same, we would say, well, there's absolutely no improvement. You're just the same. But if we take
Hmm.
this other vantage point to what's going on and look, all of these things that you can do now, no, they're not 100%, but you're doing these things that are important to you despite the pain being there. How is that not progress? And for me, getting people to shift their mindset away from pain temporarily from time to time, I think allows them to feel confident, bringing it back to this idea of confidence, that the approach that we're taking is effective for them because now we're looking at these other metrics that they can clearly see that they're getting better in. And I think pain science is just such a complicated thing. And if I had more time in my life, I'd probably go back to school to study some of these ideas, but I don't think I have the time or the money to do that right now. But I
Fair
think it's so
enough. Yeah.
incredibly fascinating when we start to look at the research around pain. And, as you mentioned, we can have people that are completely healthy have severe pain sometimes. If you were to look at every other health metric, there's nothing wrong with them. We can't find anything wrong, yet they're in pain. Or we could have someone that you look at their MRI or their X-ray and you're like, oh my God, how do you walk around? And they don't feel a thing. Like it's
Hmm.
just such this interesting world that we live in. And, we probably don't want to get too far in this conversation because I'm sure this would be another hour-long talk in itself. But, the bottom line is that pain is complex and that there are many different things that can affect it at times. So if anyone ever boils it down for you and tries to blame you or make you think that there's a single cause for your pain, especially chronic pain, um, there's probably more to that, and it's often can be a good idea to seek other opinions from professionals, because I know this is present significantly in the chiropractic profession, where we want to look at something very biomechanical. And for those of you listening, kind of means like, okay, we can look at, oh, the spot in your spine, it's not moving the way that it's supposed to. This is causing your back to hurt and your hips to be tight and all these things. And we narrow it down to these very specific points. Um, in general, outside of trauma and things that we discussed earlier, there are probably multiple factors that are contributing to what you are feeling. And the best part about this tends to give us options for those actionables that you can begin to take control. So, on average, would you say that the people that you're working with, I mean, do they have any idea of these complexities of pain? And if they don't, how much do you try to explain to your clients to get them to understand that, okay, maybe there are other things that I can begin to do to take control and to take ownership and have some autonomy in the care that I'm receiving?
Yeah, I think, we've come a long way with really establishing our mission and our community over the past few years. I think one of the coolest things and the most humbling thing about the growth of Old Bull is that we are starting to get, for the most part, people who are coming in on purpose because they know what our philosophies are and they know the type of intervention we're going to apply to them. We're getting a lot of people who have tried other things and realize it wasn't the right fit. We get people with a high level of health literacy who do understand, at least on some level, a lot of these topics. We get other people in the medical field. I mean, I work with a ton of other physios and chiros and trainers and physicians, which is the coolest thing in the world to be able to speak the same language and be a resource for somebody who gets it. Like been the coolest thing to have happened, and we're so grateful for that. But of course, we still always get people where it is something that's newer information, or maybe they've understand on a surface level that pain is pretty complex, but they're still very used to the biomedical model of, if this, then this, if this hurts, then there's something wrong. And, I think what's important is reading the room. Like, there's people who want this information and there's people who don't. And I think what I'm trying to get better at too is understanding that and not giving too much information when it's not warranted. As you were saying too, like giving somebody an experience that they're going to get the information no matter what because they're feeling it happen. So, I used to probably dive a little bit deeper into this stuff, especially because neuroscience is my background and I could talk about this stuff and the neurophysiology of it all day and get really excited when nobody else does. But I think it can be as simple as just saying pain is incredibly complex, and by the day we're understanding more about it. What we do know is that activity, being strong, being resilient are huge buffers to the pain experience, as well as some of the difficulties that you're currently experiencing in your day to day life. So, at the very least, like we already know we can work on that, and it's probably going to help. We do know that people who are more physically active have lower reportings of like self reports of pain. We do know that. We have evidence to show that. So, at the very least, if I can make somebody more active, I can feel really confident that it's going to help a little bit. And I think sometimes even just that is enough of the conversation without having to lecture somebody or provide somebody with a neuroanatomy lecture that they don't care about. But then, if somebody is craving more information, like, yeah, we'll absolutely talk about it. It's reading the room and it's understanding that not everybody's ready for that information too.
Yeah, and that's everything that you talked about from and again, benefits from being active and building strength in general. And I think this is something that probably really is the reason why both you and I probably have strong movement biases when it comes to the way that we approach care. And this is not always the case, and I think it's okay to be biased as long as you recognize for yourself what those biases are and are still open to changing your viewpoints as more information presents itself. But when I look at the reasons why I tend to be biased towards movement with patients, it's because of the things that we've talked about today. and the greater benefit that people can have from engaging in some of these activities that extends so much further beyond the passive components of care, the adjustments, the needling, the cupping, things that can be great pain modulators. They can definitely help you feel better in the moment.
Absolutely. Yeah.
But the word that you use to give people a buffer, like I love this because it is. I think it's very much this thing that can mitigate future risk for some of these health conditions and injuries that so many people deal with on a regular basis. No, like you said, we don't bulletproof. We can't completely prevent these things from happening. But on average, the people that are more active and have good movement routines and are meeting physical activity guidelines, we just know that they're healthier. And again, if we are healthcare providers and we're working in a space that people are dealing with injuries that, again, not preventable by movement, but maybe we're reducing the frequency that these things happen, or we're reducing future risk, I think we're doing so much good for people beyond these instances of pain and really beginning to have these strong effects on overall healthcare. And this brings me back to a quote that Craig had in one of our earlier episodes in this season. And it was that, in our positions as physical therapists, as chiropractors, as strength coaches, I believe he said, we're your shepherds and stewards for movement, and the world has stopped moving. And I think we can start to boil down some of these issues that we're seeing is that, no, maybe not completely attributable to people not exercising, but that might be a major component for some of the people that maybe they don't deal with as much of these things, or maybe it's not quite as severe because they've developed other physical characteristics that allow them to have that buffer. And I think for me, at least, that's why I tend to be so biased towards movement, because it provides all of this extra benefit for people beyond that moment when we're interacting with that person face to face or potentially virtually, right? It extends so much further beyond that. I'm sure you probably agree with that, but do you have any other additional thoughts or points to add on to my little side tangent there?
100%. No, I love everything that you just said. Thank you. uh, yes, absolutely. I love the talking points that you just brought up. I think of course we should always be aware of our biases, and I think that's something that is really cool about our jobs is that we constantly get to reevaluate our thoughts, so we constantly get presented with new information, and it keeps us really sharp and on our toes. I love that about our jobs. And I agree with you too, though. I'm pretty hell bent on keeping my biases toward movement because of everything that you just mentioned, and with even more of the striking evidence that's coming out about, they're finding common inflammatory pathways in people who have metabolic syndrome and diabetes, and those same inflammatory pathways happening in people who have the most common chronic musculoskeletal pain. So tendinopathies, osteoarthritis, osteopenia, osteoporosis. There's so much overlap in sedentary behavior and lack of metabolic health with chronic musculoskeletal conditions and pain that I think it's malpractice to not prescribe exercise. I think it's that serious. And I don't even think we need that type of evidence to know that, because of all of, at this point, I think we understand on some cursory level that exercise is important, but now we're actually seeing physiological changes in the tissues of people who have metabolic conditions. And if osteoarthritis, tendinopathies, and osteoporosis and osteopenia are the most common musculoskeletal conditions people have, I think that is important to look at. And if diabetes rates and metabolic syndrome rates are skyrocketing, like, there's clearly a relationship here. And I think that is I think what's important to think of that too is it could either overwhelm you or excite you. It could be overwhelming because it's like, oh my God, what the hell are we doing? Where do we even start? Or it could excite you and make you realize, even if I don't know the exact thing that is wrong with this person, if I don't have a perfect diagnosis, if I make them more active, I can literally change their life. I think that's huge for a student who's scared about not knowing what the hell to do when they get out into the real world and have to treat a patient, or a new grad who feels the same way, or somebody 10 years into the profession who's burnt out thinking we're not really helping people. I think that awareness of, even if you know nothing else to do with this person, if you can help them increase their day to day activity, you've already impacted their life significantly. And I really think that it's that serious. I think it's that important. And I think if we frame it in that way, it starts to also show how much more important our professions are. I think it's easy as allied health providers that we get overshadowed by physicians, or we get overshadowed by other professions, or we seem like soft science compared to somebody prescribing medication. But I think if you really start to, like, in your heart realize, like, okay, what I'm doing is so important, that also changes our attitude every day about what we get to do. And I think that's huge as well in a profession that I think is underpaid, undervalued, and overworked. I think if you can find that fire that gets you excited about why we get to change lives every day, like, you can, this is it. It's so obvious that we can do a lot more for people than a prescription for medication probably ever could, and I think that's huge.
We have an incredible opportunity to help people where maybe they wouldn't be helped elsewhere. And I think
Yeah.
that's a message for patients. It's a message for other providers in our spaces. It's a message for students, is that we truly have the opportunity to have a greater impact as healthcare professionals compared to maybe some of our other counterparts in different positions, because of the settings we can choose to work in, because of the amount of time that we can spend with patients, because of the communication that often we'll have outside of the visits where we're actually meeting with the person in person. And these are things that can be life changing for people. And this is not meant to take away from what any other healthcare professional does, because the people serve in incredible ways within the health space. But I also think that a lot of people are let down on a regular basis, and they don't always know where to turn. And I do agree that as physical therapists and as chiropractors, sometimes we sit at these lower tiers within the field, or at least from other people's perception. But I don't want people to feel that, well, because that's the perception of where we exist, that we just aren't important. Because as we just discussed, I think we can at times be the most important person for someone who's trying to get back to their goals. So I want to wrap things up with one last question for you that I think is pretty important for our listeners. And, I've seen a few posts about this on your page, and I know you've told this story a few times, but I'd like to hear it once more. What's the deal with you and cheese? What's
I
the
knew
story?
you were gonna ask that.
Like I just want to, let's end with something a little fun here. I've seen this multiple times. I can't recall the whole story, so I want to hear it one more time.
So the Olympic athlete that was sponsored by cheese that went viral, I'm not kidding. I think I got like 40 people who to send me that, spanning from like my closest friends to somebody I've never even had a conversation with on the internet. And I'm just like, okay, I better have something else about me that is getting this much traction to better the space of physical therapy than just cheese, because what I have done to make people realize my passion of cheese, it's impressive and startling. So yeah, the all I have to say is I love cheese. It's a very important staple of my diet. Laughably so. And like so much so that when I've had a bad day, my boyfriend comes home with a fun cheese to make sure that I've had a better day. And it's just become this thing that has really taken over, and it's hilarious that you asked me that.
That's amazing, and I don't want you to be known just as the cheese physical therapist, because you're so much more valuable beyond that label. But you know what? Maybe this gets you a sponsorship down the road, and then you can just have unlimited cheese, and will be this great,
God, I
great
hope
thing, right?
so. The amount of patients who have brought me cheese as a gift is also hilarious. Like, somebody will walk in the back room and they'll be like, "There's a block of cheese in the fridge. You want to explain that, Katie?"
See, it's already working in
So,
your favor. Like, you're already getting free cheese.
exactly.
This is awesome.
Exactly. It's all part of the master plan. That's why I became a physical therapist. It's been a long con, but here we are.
It makes sense. It's all coming together. Katie, thank you so much for spending time with us today. Are there any last bits that you'd like to leave the audience? Any last messages you have?
I think we're just going to end it on cheese because that was the perfect question to ask at the end. I really appreciate that. No, thank you, David. I love this whole group of providers, and it's been an honor to have been asked to be a guest. You've had some amazing people, so thank you so much for having me.
Absolutely. Appreciate all of your insight, your expertise. This is one of my favorite episodes that we've recorded so far, and we'll make sure to drop all your information, Old Bull's information, in the description so people can find you if they're looking for a provider in your area. And for the audience, where are you at again?
We are in Miami, Florida, so getting tons of horrifically hot weather at the moment. But yep, we're in South Florida.
Awesome. We will drop all that information in the description. And one last time, thank you, Katie, so much for being here. And until next time, guys, we will see you then.